And this is Nora LaTorre. She's the CEO and co-founder of Eat Real. Eat Real is a California-based national nonprofit that's helping school districts serve nutritious foods to students. And so she's going to be telling us a little bit about transforming the largest food distribution system in the U.S. So, Nora.
Wonderful. Thank you. Hi, I'm Nora LaTorre, CEO of Eat Real, which is a children's health and planet health nonprofit where we believe that every child deserves a healthy, delicious future on a livable planet. And I'm excited to be here today because I love the ocean. I love the ocean for its role in our planet's health and in our own health. So I'm going to actually start with talking about human health. So pop quiz time. So get ready to stand up with me for a second. We're going to get the energy moving right before lunch, okay? So I'm going to ask you a question, and I need you to think about, I'm going to tell you what the three options of answers are, and I need you to think about which answer you're going to stand up for. So the question is, from 2014, 6 years prior to the pandemic, to 2022, how much has US lifespan increased? Three options. It's increased 6 months is the first answer. It's increased 1.5 years is the second answer. It's increased 2 years is the third answer. So if you think it has increased 6 months, I want you to stand up now. Okay, if you think it's increased 1.5 years, stand up. Stay standing. Okay, that's fine. We can do it either way. Yeah, it's good. Okay, if you think it's increased 2 years, stand up. All right, I need you to keep standing. If you've already answered, stand. So everyone just keep standing. I didn't make that clear. Yeah. Okay. A few people are sitting. I'm curious, why are you sitting? Why? Oh, so the people that are sitting think that it decreased. Well, you're right. So that was a trick question. I love a good pop quiz and a trick question. I'll just have you on the edge of your chairs already. So you're right. Actually, we're experiencing what we're calling the phenomenon American health collapse. So for the first time in US history, we're seeing lifespan, health span, and happiness span drop. And it actually, the right answer is, it's declined 1.5 years. So it peaked in 2014, and that means that myself I'm an elder millennial, or a geriatric millennial, as they told me in pregnancy, which was great. Myself as an elder millennial my son, Nico, who's 3, he will live 1.5 fewer years than I will as a millennial. And that's 511 sunrises that he won't see. And I'm not okay with that. I'm not okay with that as a mom. I'm not okay with that for our generation. And millennials actually have shorter lifespans than our parents too. So we're seeing this generation by generation decline in lifespan at a time, and we're near Silicon Valley right now, at a time when Silicon Valley, and I was just in LA, are all talking about biohacking and living as long as whales. So unprecedented longevity with advances in healthcare and AI is possible. Yet what we're witnessing is American health collapse, actually a decline in lifespan. And people are very concerned about this. Actually, shoppers, and as I was just pulling stats before this presentation, want holistic health and holistic health options at the store. It is one of the top trends, but 8451 just said it, in 2024. This is starting to be top of mind for people because this is becoming very personal. What people don't realize is that when you pull, per the WHO, the biggest driver in this health collapse, the biggest driver is actually ultra-processed food-related disease. So these are heart disease, diabetes, obesity, cancers. These are ultra-processed food diseases that are preventable. Our food can make us sick, but it can also nourish us and fuel us to achieve our health goals and to expand our lifespans. I study longevity, and I actually studied this woman, Edie, who just passed, but she lived to be 116. At 114, she threw herself a birthday parade. Her whole town came out for it in Northern California. Yes, we have some longevity scores here in California. And then at 103, she actually put an ad out in the local paper that was "Come dance with me." And so at 103, she was looking for a new dance partner. So it is possible to live a very long life, but for most Americans, lifespan and health span is declining. Now, what does this have to do with why we're all here today and oceans and healthy, nutrient-dense products? It has to do with just that. It has to do with that. I believe that if we can make real, delicious, culturally relevant, sustainable, good options, the easiest options, affordable options, then we can really nourish people to expand their lifespans and health spans. Fun fact, this isn't a quiz yet, but one is coming, can you tell? Fun fact that 90% of our serotonin, the happiness hormone, is made in our guts. So actually we can think about feeding our mental health as well. So this is about like lifespan, health span, and what we call happiness span. And so we at Eat Real work on changing our food system at scale, and we do that to help restore lifespan, health span, and happiness span. And also kids, we're working on a project with Stanford that shows that diseases are on the rise in kids, preventable diseases, fatty liver disease, chronic kidney disease. They're testing Ozempic on 6-year-olds. Like, our kids in America are getting much sicker than we're even talking about. And so this is very urgent. So at Eat Real, we work upstream to make changes, and we work to change our food system to make real, delicious, sustainable, ocean smart, blue food accessible. And so we do that with the largest fast food restaurant chain in America. So who knows what the largest fast food restaurant chain is in America in unit size location? Pop quiz. Does anyone know? Okay. Stars. Subway, yes. Oh my goodness, yes. Subway is, thank you, star students here. So Subway is the largest fast food restaurant chain in America in unit locations with 20,000 Subways across our country. Like, you'll all of a sudden just start seeing Subways. Trust me, you're like, Willie, is it Subways and not McDonald's? No, just look around. You're gonna I start seeing Subways everywhere now. But that was a trick question, because actually the largest restaurant chain in America is our US public school system. There are 90,000 public schools in America. They serve 7 billion meals. There's one as an anchor and a food access hub in almost every single community in our country. And so we at Eat Real help schools overhaul their food and make it the best restaurant in town for what we call the most important customers. And so I was just at school lunch yesterday because it's my favorite. It's so good, it's possible. And they're serving up amazing, delicious food that feed kids' mental health, that feeds their growth and development, that helps prevent disease and helps kids expand their lifespans and health spans. And so we really believe that schools can be these huge champions of real food and of blue food, of sustainable seafood options. So for a couple just quick examples of what does that mean and what does that look like, we're seeing that schools are buying seafood alternatives, like making beet poke bowls. That's a real thing on a school menu. They're buying fish seconds, bycatch. They're buying sustainable seafood. They're making amazing sustainable seafood tacos. That's like one of my favorite things on school menus. And so it's really cool to see their potential. At Eat Real, we're going nationwide, and we can optimize $1 billion of US cafeteria budgets by the end of next year. So the size of the opportunity is truly massive. And so that's a little bit about Eat Real and a little bit about why we do what we do. And we know that people really care about this. We have parents, grandparents, community members, doctors reaching out to us every single week. Sometimes it's like multiple times a day, to get their communities involved in, because they want to transform their food system. And so that's why I was excited to come and talk to you all today, because I believe that you represent the most important parts of the food system: the suppliers, the farmers, the storytellers, the NGOs, the food companies that are helping innovate our food system to be more planet smart and healthier for kids. I wanted to just share a couple of thoughts as I was sitting here looking at all of you so very engaged in this conversation. two kind of prompts for you are, one, what, as you're at lunch momentarily, but how can you really safeguard our food system and accelerate solutions that work, while carefully interrogating any potential unintended consequences? So you have a big responsibility as food leaders to think about your innovations, whatever, as you're working on blue food solutions, how can you make sure and be certain that the options that you're creating are indeed healthier for the planet without unintended consequences, and actually leapfrog current solutions and make them more nutrient dense? So that's just a question I think that's really, really important. And if you can present solutions, then people will trust them, buy in, and then we can really accelerate options. But we're seeing that's super important to show people that the options that are being presented to them for food are better for them and better for the planet, and that it's not a trade-off of one or the other. And so that's what I'm excited about this group. The other prompt that I want to share is to get really passionate about this, because the more and more I talk to consumers and to parents and students, they want options that are safe for them and for the planet. So as I've learned more and more about blue food, and I'm becoming a blue food champion and an ultramarine champion, and I'm a scuba diver, so I just really care about this. I think that people don't realize how much plastic is in our food. They don't want a side of mercury. They don't want contaminants. And people don't even realize yet how unsafe parts of our food system are. And they want to be able to trust and know that the options that are in front of them are a better option for them, and that they are safe, and that it's not coming with a side of plastic obesogens or with a contaminant that can hurt their unborn child's development or neurological development. And so I think it's just something to really talk about and to think about, is how do you leapfrog and provide better options and really show consumers that there are more nutrient dense, safer, positive options. And so I think that's one big thing for this group. And I'll just share, so those are two prompts for you at lunch to talk about. What are some ways that you can make sure that you're safeguarding impact and being thorough about your impact? And then how can you educate consumers and make it really easy for them to understand the benefits of blue food? And then this is eatreal.org. I'll just share, and you can connect with us. You can sign up for our newsletter, which shares a lot of fun facts and quizzes like I just shared. And we work with the best doctors, chefs, and leaders around the country. So some really exciting impact that we share. And then also you can connect with me on LinkedIn, et cetera. I'm happy to have a conversation with you and just keep this conversation going. And so I think those were the main things that I wanted to cover. But yeah, I'm really grateful to be here, and I'll be around for a little while afterwards. So I would love to connect with all of you. And I just hope that you'll think about what is your role in expanding happiness span, health span, and lifespan through food, and how can you see yourself as a blue food champion, as an ocean champion, et cetera. And I think you all talk about it probably all day at work, but then also be raising awareness and creating the culture change that we need to accelerate solutions at work. Thank you.